everyone, my name's Jackie and I am a brain aneurysm and AVM survivor. I have suffered from 3 brain aneurysms and 1 AVM. We are unsure exactly if all 3 of the brain aneurysms ruptured, but we are sure that definitely 2 did and the AVM is well bled. It's been a long 18 months for me. It's been a really hard 18 months for me. And my whole existence right now, I feel like, is based on patient advocacy and letting people know the signs and symptoms and when to get tested and why they need to, because these are silent killers. And there was a lot of people really don't have any warning. I mean, I did, but it's not always the norm. It happened on March 29th. 2013. It was around midnight, and I had woken up my husband, and I don't remember any of this, but apparently I was holding my head and kind of looking down, and I said, "You have to get up and call my mom and call 911 because something's happening, and someone told me I was going to die if I didn't get help." And that was pretty much all he needed, to get up and call my mom and 911. 911 answered. My mom did. She was asleep. So I called her back, and she answered, and apparently I was talking to her for a few minutes and telling her some symptoms I was having and being very vague about the whole thing. But I knew enough that something was very wrong. I was saying I did have a headache, but I was not saying the worst headache of my life, although I did say it a couple of times during the night. I told them I was having blurry vision, and I was nauseous, and I started vomiting on the balcony. So those to me were pretty clear-cut signs of a rupture, but unfortunately the first hospital that I went to did not recognize the signs of a bleed, and then I went unconscious, and then they did a scan of my head and realized that my whole head was full of blood. It was a grade 5 bleed on the Hunt and Hess scale, and I was air flighted to another hospital nearby. And I went unconscious and went to respiratory failure, and I was in a coma for about 2 weeks. I don't remember any of my stay at the ICU. I don't remember any of the doctors, anyone staying with me. My family did not let me stay alone one night. Someone stayed with me every single night, and they were all by my side, and I'm so thankful for that. But I don't remember any of it. I had amazing nurses, and I don't remember them, unfortunately. But I was told after I came out of the coma and my ventilator was gone, on April 20th, my daughter's birthday, she did come by to see me. Both of my girls did. And although I did remember Aubrey, my oldest daughter, I had a little bit of trouble remembering my youngest, Madison. She was 8 months old at the time of the rupture. My first real memory is about 7 weeks after the initial rupture at the rehab hospital. It was a very vague memory of being transported to another hospital to get a scan of my head because I had fallen. Because of my confusion, I earned myself a little babysitter in my hospital room for a few weeks, and an alarm on my bed and on my chair because I was always trying to get up. And I do remember for a while I thought I was working. I had to work. I had a hospital band on, so I must have been at work. And I really couldn't understand why this was all happening to me. I kind of thought it was funny, though. I was not allowed to have a phone on me because my husband and my doctor thought that it probably wouldn't be good. I would just be calling people and looking things up, and they were right, because the minute I learned how to use the hospital phone, I called everyone. And my mom would get phone calls at about 5 in the morning from me, because my time management was all messed up, and it still kind of is. And then my sister and brother-in-law bought me an iPad. So once I got the iPad, I started looking up AVMs and brain aneurysms. And even though I was a nurse, I never really studied neuro. And once I started digging into some research and finding out all the devastating things that go along with it, I was shocked. And that is when reality started to set in and I was scared. I had a huge fear that I would never make it out of the hospital alive. I would have bad dreams that there would be a fire in the hospital and I wouldn't be able to get out because I couldn't walk. And I would just be left in there, or that someone would come into my room at night and there was nothing I could do about it. It was very bizarre, and these fears were very real and they were scary. The rehab hospital, it was awesome. I did therapy 3 times a day for an hour apiece, speech therapy, occupational therapy, and physical therapy, where I learned everything from learning how to make a sandwich all over again to speaking, because my vocabulary wasn't very good. I would slur a lot and I would stutter and I would forget things, a ton of things. There was this one exercise in physical therapy that they had me do, and it's called a floor recovery. And if you can't walk and you're confined to a wheelchair, which at the time I was, they want to make sure when they send you home that if you were to fall at home out of your chair, you can pull yourself back up and get in it. Well, this is very hard, and for someone who's already pretty weak and who's been in bed for quite a while, it was almost impossible for me to do. You would have to pull yourself back up into the chair from the ground and just prove that if something happened, you were capable of taking care of yourself. And I did it. Not great, but I did do it. When I went home, it had been a little bit over 2 months after my initial injury, and things were moved around in my house. Things were changed around. I didn't recognize things. I was confused. I didn't feel like I belonged there. I felt out of place and I was scared all the time. And I had a hard time getting around. I couldn't go up the stairs, and I definitely couldn't go down the stairs, and I had a baby at home. And if I wanted to bring her downstairs, I would have to put her on my lap and we would scoot down the stairs on my butt to get downstairs. So, I mean, I can't even explain the amount of determination and strength and support it took to get me where I am today. My main deficit now that I struggle with miraculously, I really don't have that many, but I do have double vision. I've gotten 2 surgeries to correct that, and yes, it's improved, but it's not great. I have prisms ground into the glass in my glasses, and although, yeah, I think I kind of look cute in my glasses sometimes. I don't want to wear them all the time, but I have to. And I still see double with the glasses. However, it does straighten things out just enough for me to see and drive with them. I had a paralyzing fear of driving for about 16 months. And within the past month, I just started driving again and just started taking the freeways. And, you know, I'm no pro, but I get where I want to go and I get to where I need to go. And if I'm feeling dizzy or unsafe, then I don't drive that day. But for the most part, it's all about your will and determination and your support system, because if you have no support, you have nothing. Everything that you do from the point you wake up in the hospital up until now, it's all depending on the support system you have, who is going to be there for you. I had my husband and my mother and my sisters drive me to doctor's appointments constantly. I wasn't allowed to be alone with my daughters for about 2 months after I came home because it was unsafe. Just every certain, I mean, everything. It requires patience and support and people to help you, because if you have that, you have nothing. Your emotions are all over the place, and I can't say that they'll be 100%, but they do get better. I feel like I've gotten more intelligent and witty. Maybe some would disagree, but I think that everything happens for a reason, and although I wouldn't want to wish this on anybody, I feel like maybe this happened because I was supposed to spread the word and be there for other patients going through this, and just to help them along and let them know it's awful, it's horrible, and it's so hard to get through. And I honestly believe the recovery is never ending, and you will have to work hard at it every single day until the day you die to be okay, but you'll never be normal again. And that's okay, because I don't know very many normal people anyways. But thanks for listening to my story, and I just want to spread the word. And if you have any of the signs or the symptoms of an aneurysm, get some help. Go to the doctor. Request a scan. Be persistent that they give you what you're asking for, because nobody knows your body like you. So get scanned and get tested and put your mind at peace. That's all you need. So thanks.